Welcome to this clinical walkthrough on the primary dysmenorrhea case for UKMLA, brought to you by Medi8, your 24/7 practice partner. We're going to break down exactly how you can nail this common OSCE station step by step. Okay, let's dive right in. How you start the consultation sets the tone for everything. It's really just a simple two-step process. First, you introduce yourself and confirm their details. You can say something just like, "Good morning, I am Dr. Name. Could you please confirm your full name and age for me?" Easy. Then you open the floor to them with a nice open-ended question like, "How can I help you today?" This lets the patient start their story in their own words, which is exactly what you want. All right, now we're into the heart of the consultation, the history taking. This is where you really score your points. Having a structured approach shows the examiner you're methodical and know exactly what you're looking for. It's not about firing off random questions. It's about having a system. And when it comes to pain, your best friend is the SOCRATES mnemonic. Seriously, this framework is your go-to for any pain assessment. It's a fantastic tool to make sure you systematically cover all the bases without missing any crucial details. So let's apply it. For sight, you'll ask, where exactly do you feel the pain? For onset, it's, when does the pain usually start? With character, you want to prompt them a bit. How would you describe the pain? Is it a sharp pain or more of a dull ache? For radiation, ask, does the pain travel anywhere else? Then for severity, the classic, on a scale from 1 to 10, with 10 being the worst pain imaginable, where would you rate it? And finally, for alleviating and aggravating factors, does anything make it better or worse? See? It just flows. Once you've got a handle on the pain with Socrates, it's time to zoom out a little and broaden that history. You need to screen for associated symptoms, so ask about things like nausea, diarrhea, or dizziness. A good menstrual history is obviously key. Ask about regularity and flow. But what's absolutely critical is that you ask about intermenstrual bleeding. Any bleeding between periods is a potential red flag you cannot miss. And then you'll round it out by asking about family history and their smoking status. Now, this next question is a big one. It's what separates a good doctor from a great one. You need to ask, how has this pain affected your life? This is about understanding the impact. Is she missing school or work? Is it stopping her from playing sports, affecting her sleep? This shows you see her as a person, not just a set of symptoms, and that's a huge deal for the examiners. And that leads us perfectly into the ICE framework: ideas, concerns, and expectations. This is how you build rapport and create a patient-centered plan. You simply ask, do you have any thoughts about what might be causing this, to explore their ideas? Then, is there anything you were worried about, to address their concerns? And finally, what were you hoping we could do for you today to manage their expectations? It turns the consultation into a real partnership. You know, hearing about these frameworks is one thing, but actually using them is another. You can practice this exact case right now and get objective feedback on mymediate.com. It's a great way to put all this theory into practice. Okay, you've got a fantastic history. Now we move on to the examination and diagnosis phase. Remember, in an OSCE, you might not actually perform the exam, but you have to be able to talk through it clearly. Let's look at how to do that, and then how to deliver the diagnosis effectively. You'd kick things off by gaining consent. Something simple like, I would like to do a quick general check. Is that okay with you? Then just list your steps out loud. I'd check your vitals and have a look at your general appearance for any signs of pallor. You'd also mention you'd want to perform an abdominal palpation with their consent. And of course, you must always offer a chaperone. Once you verbalize the exam, it's time to share your thoughts. And the wording here is so important. Using a soft, reassuring phrase like this one makes all the difference. From the information you have shared, it sounds like you are experiencing a very common condition called primary dysmenorrhea. It's gentle, it's not alarming, and it opens up the conversation. Now you have to explain what that medical term actually means. Ditch the jargon, keep it simple and clear. You could say, primary dysmenorrhea is just a medical term for painful periods. It's caused by natural hormones that make the muscles of the womb contract during your period. It's actually really common in young women. And here's a pro tip. After you've explained the diagnosis, just pause, take a breath, and check in with the patient. A simple question like, does that explanation make sense so far, is so powerful. It gives them a chance to ask questions and ensures you're both on the same page. So she understands the diagnosis. Now it's time for the management plan. And the key word on this slide is collaborative. You're not just telling her what to do, you're creating a plan with her. A great way to structure this is to lay it out like a roadmap. You can say,
So let's talk about a plan. First, we'll look at some pain relief. Then we can talk about other things that can help that aren't medication. We'll also touch on lifestyle and support. And finally, we'll discuss what our next steps would be if things don't get better. It's clear and logical.
For first-line pain relief, you'll suggest an NSAID, like ibuprofen. But here is the most important piece of advice you can give. Tell her to start taking it as soon as her period starts or even a little bit before. This proactive timing is what makes it so much more effective than waiting for the pain to get bad.
Then you move on to the non-medical stuff. Simple things can make a huge difference, like using a warm water bottle or a heat pad. You can also mention TENS machines. And don't forget the lifestyle advice. Getting enough rest, eating well, and staying active can all help. It's about giving her a whole toolkit to manage this.
You also need to give her a clear idea of what happens next if the first plan doesn't work. You can explain that if the pain is still a problem after a few months, you could then consider trying a low-dose combined oral contraceptive pill, as that's often very helpful. We're on the home stretch now, but this last part is absolutely critical. Safety netting and closing the consultation properly is non-negotiable for patient safety and for passing your exam. Let's make sure we do it perfectly. Good safety netting is all about being specific. You need to give clear, unambiguous instructions. Tell her exactly when she needs to come back, if the pain gets worse, if it starts happening outside of her periods, or if any new symptoms pop up. And give a clear timeline for follow-up, like 3 to 6 months, so she knows what to expect. And to wrap it all up, just follow these 4 simple steps. Offer a patient information leaflet. Give a quick 1-sentence summary of the diagnosis, plan, and safety net. Then, and this is important, always ask, is there anything else you would like to ask? And finally, a polite thank you. That's a professional close. And there you have it, a complete blueprint for acing the primary dysmenorrhea OSCE station. Following that structured, patient-centered approach is your key to success. Now, the best way to get this into your muscle memory is to practice it. You can practice this exact case now on mymedicate.com.